Welcome to another Salt Bake Patient Profile Green Scene. In this follow-up visit with one Nicole McGarry, a Utah resident, who is facing a life-threatening medical condition and had been bedbound for years. Listen to find out how her medical cannabis recovery began 3 years ago. And now, thanks to medical cannabis, learn her amazing story of how she's now free of her bed, able to communicate, drive, and spend time with her family. Welcome, Nicole McGarry. Nicole, by way of introduction, could you please tell us a little bit about your journey to becoming a medical cannabis user?
Sure. I started a couple years ago when the law was passed. I started on December 1st, once it went into effect. I started my journey on medical cannabis from having terminal gastroparesis, along with multiple other medical conditions, a lot of nerve pain conditions, heart conditions, that led me to trying cannabis for my stomach. I was on feeding tubes, nasal feeding tubes, stomach ports, PICC lines for 3 years, which I'm glad to report I no longer have my PICC line and have been able to take it out.
3 years. Wow.
Yep, 3 years. 3 years. I was bedbound for 2 of those 3 years. I've been in better recovery over this last year since starting medical cannabis edibles, which made a dramatic change for me. It is the difference between night and day and being able to function and not function.
Wow.
So it has really given me vast improvement in almost every single one of my medical conditions.
Right. So what are some of the things specifically, Nicole, that you can do now that you were unable to do in the past 3 years as a result of cannabis treatment?
One big thing is I am now driving again. I was able to
All
get
right.
my driver's license back, and I didn't drive for 5 years because of neuropathy in my leg. I am driving. I am able to walk distance. I am up out of bed. I was completely bedbound for 2 of the 3 years to where I really just couldn't even get out of bed for other than a few minutes a day. I am cooking again, which is lovely. I was not able to eat, so of course you don't want to cook, and I love to bake and cook, so I'm up in my kitchen all the time. I'm spending time with my family. I'm able to communicate. I'm able to do things that I wasn't able to do for so long. I can hike a little bit now. Sometimes I'm still in a lot of pain in my legs. I have flare-ups, and sometimes my stomach even flares up a little bit, but it's really easy for me to now control with the cannabis products that I use. So I'm doing so many things. This year was the first year in 4 years that I did a little vegetable garden and have a little herb garden. So many things that we don't think about that we do on a daily basis, I'm now doing. So it's been amazing for me. It really has been amazing for me.
Thank you for that, Nicole. It must be, I mean, I personally can scarcely imagine what that sort of transition must be like. I'm glad that you're finding new freedoms. That's superb. Really happy to hear that. May I ask, Nicole, what specific effects or general benefits do you look for in a strain of medicinal cannabis or in a medicinal cannabis product?
I believe in whole body cannabis treatment. So for my neuropathies, I like to use topicals because my neuropathy is at the skin level. So oftentimes I feel like I'm on fire, so I use topicals. It depends on variety of strain. There's a lot of different strains out there of cannabis, and formulation matters.
Sure.
We have things like tinctures that I use for under the tongue sublingual. I use edibles, which I have now found that I don't necessarily need it in a cube gelatinous form that we have here, that you can simply take THC oils into your stomach as the edible, which is working very well for me. I've also implemented more CBD as well. I don't think CBD as is as well understood. A lot of people think it doesn't really work because you're not getting a immediate release like you do with cannabis. Some of my ultimate favorite daytime strain would be Blue Dream. Blue Dream is a hybrid that has a very level effect to it. It allows you an uplifting feeling. So I can get so much done if I use a Blue Dream strain or a hybrid that has Blue Dream in it. Great for pain, but it helps to control pain, but still allows you to function and do something without such an intense psychoactive high. But I've also found that now with CBD, I had never really used CBD in high milligrams through my treatment. I had generally done a 1-to-1 tincture and it was working. But once I started implementing more CBD into my body, that helps sometimes because you do have indica strains that are indica leaning that make you a little more sleepy but are more effective with pain. And sometimes for patients, you need to get things done or you want to be able to do something. You don't want to be sleepy. So CBD really has helped to offset some of the psychoactive when they're a heavier formulation or a higher percentage. So I've really had to work hard to find a balance between strains, formulation. I never really even realized as a patient that the way we take it matters for the disease you're treating.
Could you explain a little bit how you came to that understanding, Nicole?
It's been through experimentation with myself with cannabis products.
What does your doctor have to say on this?
My doctor?
I'm just wondering how you came to your methodology. Did you just simply microdose at first and just moved on from there and just found the right combo after trial and error?
That is correct. It did start with microdosing. In all cannabis products, whether you're new to cannabis or you're familiar with the effects of cannabis, I would always say start very low and slow and slowly increase your dose to what makes you feel better. My doctor has been an absolute awe of my recovery. I was terminally ill in bed, ready to die. I really had only a couple weeks left when I started this journey with the edibles. I was in dire shape. I was not proceeded to live another week. And taking an edible, it was an immediate effect. I didn't actually choose to see my doctor until about 4 months after I had started because I wanted him to see the results of what he had recommended for me. When I went into my doctor's office, I walked in for the first time without a cane or a wheelchair or a walker. He's profoundly in awe, to say the very least, at my recovery because I am literally not taking one stomach medication. I have reduced opiate use to maybe one a day if I'm having a bad flare-up. That wavers when storms come. I'm a little worse for wear. But I was taking morphine, hydrocodone, and diazepam every 4 hours for a couple years. To have that kind of reduction, no stomach medications. I'm off my heart medications. I'm literally taking my thyroid medications and insulin at this point, but it has really had an effect on every disorder and disease that I have. My doctor's not even sure, are we treating this or is it curing it? We are going to wait about a year to see how I do, providing everything goes well for another continued year, and then rerun my tests for gastroparesis. Because I'm able to eat now, which that's another thing we take for granted is putting food in our mouths as human beings. That seems like such a natural thing that we do. But if I said to you, you can't eat nothing, and that's going to be for the next 18 months, you would think I'm out of my mind. But that's what I went through. I
Well,
was
Nicole, I'm so
eating
happy to hear
so
that you've
fast.
improved so much. Sorry, I just to interrupt. I just wanted to say that everyone at Salt Lake City is delighted that you're making so much progress.
And it's a progress, to be honest with you. I had started vaping cannabis, and I was using a tincture when I first started. But through experiment of different formats it comes in, such as edibles, even concentrates like the wax that you use when you have to dab that when you're in really bad pain. I never expected as a patient, because I had already received relief with the few products I first started with and experimenting with strains and formulations. I never expected to recover like this, ever.
What was the process of getting your medical cannabis card here like? Where did you go?
I actually, because I was working on Prop 2, and at the time that we were working on getting signatures for Prop 2 is literally when I onset with gastroparesis. So I went through many doctors, and I finally found a couple good doctors that were able to really help me. So I started prepping my doctor long ahead of this, because we had ran out of treatment options for me. We had tried everything that you could for stomachs, even feeding tubes, and nothing was working. I was declining very rapidly. So I had said to my doctor, listen, I'm going to have to try this. Are you
Which
on
medical
board?
cannabis pharmacy or QMC? Where did you go to get the card and whatnot?
For me, it started with my primary care physician through Intermountain Internal Medicine.
Were they
And
supportive, Nicole?
my doctor was very supportive. Not everybody, not all the doctors inside of the same practice were necessarily supportive. They were nervous about it, not having research.
Was your physician familiar with cannabis at that point? What did they know?
He didn't know a lot, to be honest. He's learned a lot through me, that how it's affecting, and now he's very supportive of medical cannabis. He, however, is not a QMP. He did do my recommendation and had my letter ready December 1st. We had talked prior to the election that if it passed, would he write me a letter of recommendation? And he said I would. I had my letter waiting on his desk December 1st.
So how would you characterize the process of getting your medical card? How would you describe it? Easy, hard?
No, it's by no means easy. I was definitely lucky in the process, because even though I had my letter of recommendation, when cards became available, my pain management doctor, who is a QMP, took over my recommendation and helped me get my medical cannabis card. And they have been supportive long before it was ever legal. My pain management doctor had always said, you know, if it comes, you would be one of the first patients I would recommend to. And I was one of her first patients. And getting my card, my recovery has changed my doctor's opinions of medical cannabis. So now they're all more on board, but it's not easy. There are so many patients that reach out to me now just because of you all following my story months ago and articles that I've done. A lot of people have seen my progression. So I have a lot of patients reach out to me that are gastroparesis patients, nerve patients that have nerve conditions. And it's a lot. It's hard to handle hearing people's stories about trying to get their medical cannabis cards, because although many doctors, we have, I believe, over 400 QMPs now that have registered in the program, and that's helping. However, affordability with insurance, a lot of insurances won't cover those appointments. So we still have tens of thousands of patients out there that are seeking their medical cannabis cards. But even with the changes that our legislators made with upping the cap of patients they could do was increased. But in some practices, that's simply not enough. One of my doctors is home health and hospice. And when you have dying patients that all want to be on cannabis, but you're at your cap of patients, it's difficult. So we still have a real problem of patients being able to get qualified with their providers, because either their providers are not on board with the program, they're not becoming QMPs.
Yeah.
And I understand that on the side of doctors, because in the United States, we don't have a lot of research. We have some research, though. But if you look at global research on it, there's enough research out there for doctors to see the efficacy of cannabis.
Any thoughts, Nicole, on what we could do to help make that happen as medicinal cannabis patients?
We need to continue to educate. I think education is the absolute most fundamental resource we have. Knowledge is power. It is patients not being afraid to be in the closet anymore, that it's a stigma, that, oh, you're using a bad drug, or it's taboo, or people just want to be high. I know so many patients who use non-psychoactive formulations.
Sure.
And it is through education, patients coming out of that dark closet that you've been put in, to make you feel like you should be ashamed for using something that makes you feel better without 1/10 of the medical side effects of big pharmaceutical medications.
Right. How does the cost of medical cannabis stack up against your previous regimen of drugs and treatments?
I had one medication that was $3,000 a month.
Right.
If you take the cost of 27 different medications that I've gotten rid of, it's astronomical, in the tens of thousands of dollars savings for my insurance company. But yet my insurance company still cannot assist me with medical cannabis costs. So there is some differences. It can be expensive for some patients to treat with medical cannabis. And that's something else that we really need to work on in our state, like other states have started to do, to implement where insurance has to cover in your state medical cannabis use. Because there are patients who are not treating themselves adequately. I think a lot of patients in this state are finding that, yes, it's a new market and you expect things to be a little bit more expensive when something's new and starting. That has been in every medical cannabis state that has started a new program. So we hope for price decreases happening over time as our market builds, our products build. But there has to be some changes in there somewhere, because patients aren't treating themselves to get the relief they need with cannabis. They're not. If somebody can only afford to go get 2 grams of cannabis every 2 weeks, but they really need 50 to 100 milligrams of THC or CBD a day, how is that affordable to anyone? So a lot of patients are not getting as much relief because they simply can't afford their medicine and all the formulations. I use 5 different formulations. That's 5 different products I have to purchase. However, I have learned how I can take my cannabis flower, how I can process it into other formulations myself, which is allowable under the law. And a lot of patients don't even realize that, that oftentimes out of your flower, if you were to process and say an oil that you can now use as a tincture, you can put it in a capsule and take it as an edible, that you can actually get more milligrams than if you were just to vape the flower. So it's patient education. It is society education. Because if you see someone like me, you would see me on the street now. If you go out, people see me, they would not even know what is going on in my body in the moment, that I may be in a lot of pain, or that I've have these illnesses that without medical cannabis, I wouldn't look the way I do. So people see me and they're like, this isn't a girl who's sick. But yeah, if we even look back at when we did my first patient story of how I looked, if you see me advocating during Prop 2 and you see me at 88 pounds with my skin hanging off my flesh and no color to my skin, you would have saw me on death's door. And now people see me and they're like, she's not even sick. How can she be a medical cannabis patient? Because this is what it's done for me. Without it, I am a mess. Like I relapse very quickly if I'm not on medical cannabis. I went off cannabis for about 4 days and lo and behold, my stomach immediately started to relapse. And I was like, nope, we got to go back on it. So education is key. And that's not just patient education. That
May
is
I ask,
talking to
Nicole?
the person who doesn't know anything.
May I ask, Nicole, and some people view that constant, continual usage of cannabis that will have less effect over time. I'm wondering, since you use a mixture of different products, have you experienced that at all?
With some things. For example, if I'm vaping my cannabis, it will take more over time. So I have to vape a little bit more to get the same result. I don't find that in topicals. Topicals are very consistent. I don't have to apply more topical per se. Topicals are consistent. My tinctures seem to be very consistent. That I'm not having to use more tincture than I did before. I notice it more in the vaping and in edibles. However, I am a believer as a patient that occasionally you do need to do a break. When you do a break, you're kind of resetting your endocannabinoid system so that you don't have to use as much product. I see some patients that have told me that I can vape an ounce in 3 days. But if you can go 4 days, 5 days, and not use that cannabis product, your system will reset. So now when you go back to vape after a reset, you may take 2 puffs and you're like, whoa, I am good, compared to where you may have had to vape 2 or 3 grams prior to your stop. But on the same token as that, how does a patient who's using medical cannabis just do a cold stop for a few days when you're treating your illness? So a lot of patients are seeing some fluctuations, but that was the same on any pharmaceutical I was on. I was taking gabapentin. 3,200 milligrams a day is max dose. And I was on max dose for a long time with a lot of very unwanted side effects. Well, I started initially at 200 milligrams and then I needed 400 milligrams. Now I need 800 milligrams 3 times a day. So it is the same really when you're using cannabis as a medicine, that you kind of have to look at it that way. That I may need to increase my dose. I have found with reset though, for example, if I take an edible, I started out on 2.5 milligrams a day.
Is that your favorite method, Nicole?
It is for my stomach. That is what helps my gastroparesis with the pain, the digestion, appetite. It increases my appetite and stimulates the appetite a little better. So for me, for that particular disease, yes. But for pain, I have to vape or I have to use a topical. If my pain gets really bad, my last resort is heavy concentrates because they are strong, like waxes and that. They can be very potent. So a little tiny bit goes a long ways. So I don't really have any one method that I prefer over another because I'm treating so many different illnesses with so many different formulations. If I don't take my edibles for a couple days, and even though I may vape or use a tincture, if I go off an edible for a few days and then I go back to an edible, it's no longer 10 milligrams. I have to start back at the 2.5 to 5 milligrams. So even resetting a formulation. So if you're a vapor and you're using that for pain and you need to reset your endocannabinoid, maybe try an edible for a few days so that you're not vaping, and then go back to vaping to see if that reduces how much flower you have to vape. Because I've found that to be true in all the methods. So if I'm vaping flower or a vape cart, and then I start to have to use more and more, I'll stop that method, change to another method just to get me through a few days reset where I'm not vaping or I'm not having to use higher concentrates, and my system will reset, allowing me to use even less medication to treat. Because I do believe that you should, with any medication, when you're trying to treat or even cure, because I don't know that my gastroparesis is not cured. In a year from now, we will rerun the test to determine, has it improved it? Is it improving curing it? My doctor and I just don't know. We may not have those answers until there's more research. But we can't determine with our illnesses, any illness, is it a treatment or is it a cure? But there is a lot of research out of California, especially for stomach things, where they are showing that cannabis is curing, not treating otherwise diseases that were thought incurable, which gastroparesis is one of those. So I'm going to knock on wood right now and hope for the future that this isn't just a treatment for me, that it's actually healing my body.
Right. Wow. Wow. Have you ever felt the need in your cannabis journey to hide your usage of it from family or friends? And if so, why?
Prior to legalization, yes. Not ever with my family, though. My family has been supportive in this whole process. I, like many other patients, when it comes down to you're dying or you're going to live, you don't allow a law to dictate your life to you. And I became one of those people that said, I didn't have a choice to start on a tincture prior to legalization. It was, if I try nothing, then I am going to die. There's no doubt. My doctor would sit here beside me and say, we would have lost her. We would have lost her. And we tried everything we could. But because the law said you can't have this, she didn't try it. That was not my case. I started on the tincture 3 months prior to legalization. It was a terrifying time. You are worried, am I going to jail because I'm trying to save my life? Am I going to be ostracized by my community because they're going to view me as a drug user or a stoner, that I just want to be high? I actually don't prefer the psychoactive. I need it sometimes, but I don't necessarily always like the feeling it gives me. It can give me an uplifted, happy feeling, but then, like I said, it can make me really tired too. I don't want to be tired. I don't want to be back in bed anymore. I spent enough time there to last a lifetime of being in bed. So yeah, it's scary. And I don't hide it anymore. I am a very upfront, open, out there patient. Ask me and you shall receive. Don't ask me and you still will receive my knowledge. I don't think I talk to a person that I do not educate about cannabis, because anyone who knows me has seen me come from this devastating place to where I am now. Ask me how I got here. People used to see my PICC line in my arm and they'll be like, what's wrong with you? Well, I'm going to tell you not only what's wrong with me, but I'm going to tell you what's helping me. So I don't hide anymore. I don't care. I will speak to police officers. I will speak to legislators. I will speak to the common person on the street, because like I said, the only way we change this stigma is through education. That means educating each other as patients, share as a patient what you're treating, because the next patient next to you may have the same thing and not know anything about cannabis, that they may have a different choice. in medication, in treatment plan that could work for them. Patients need to share their stories, experiences, and how it's really helping them. What did it change? Don't just say you're taking medical cannabis. Okay, what is it doing for you? For me, it keeps me from throwing up 27 times a day and going to the ER room every day and being admitted. I
What's
had
the first thing? Oh, you had 102 what?
I had 186 hospital visits in 1 year with 4 admissions. I
Right.
have not been to the ER one time this year, not once.
On
I
average,
am
how many
doing
times were you visiting the ER prior to your cannabis treatment?
well. Out of 365 days, I was there 186. So it
Wow.
was every day to the ER almost, or a week in between, and I'd be right back in the hospital and then ER for multiple days in a row. When gastroparesis is your stomach is paralyzing. So no matter what you put down, it's not going down. No matter what you eat or drink, you're going to throw it up or it's not going to digest. And it makes you deathly ill when food sits in your stomach for 5 days.
Oh,
So, I mean, you get really sick.
wow.
So, out of that was just 1 year. I've been dealing with this now for 3. This is the 3rd year. So, on my 3rd year through cannabis recovery, not one ER visit, not one. And I'm going to knock on wood right now because we're almost towards the end of the year and I'd like it to be a full year.
Right.
So, no ER visits this year. I do my doctor's appointments just like how you're interviewing me now. I have not even gone in to see one of my physicians physically since this pandemic started, which is nice because the appointment's over the phone when you don't have to be jabbed and stabbed and poked. And
Well, there's also
I mean,
relief from that as well. I mean, it sounds to me like constantly having to visit emergency rooms and hospitals, like you mentioned, the stabs and jabs. My gosh, that in itself,
oh, I
what a
can't even
tremendous
tell you.
relief.
Even for my family. I mean, you have to imagine that when you have a chronically ill patient, you are not just talking about the patient.
Yeah.
You are talking about their family members that take care of them. You're talking about your friends who worry sick about you. It affects a whole community of people when you have a chronically ill person. It literally takes a village to take care of that chronic ill person. My husband was exhausted. He had to take over all household duties, including laundry, all cooking, all cleaning, because I'm so weak I can't get out of bed. My now 22-year-old son spent the last 3 years taking care of mom while dad's working full time plus overtime, and then taking mom to the ER every day because I have to call him and say, nope, I've got to go to the ER. I need you to come home right now. Or as soon as he walks through the door after a long day, he's taking me to the hospital. Your caregivers go through what you go through. They may not have the illnesses, they may not experience the suffering, but they have their own suffering through exhaustion, an overwhelming sense of fear. Am I losing my mom today? Is this the day I wake up and go check on mom and she's dead? Is this the day I walk in to check on my wife and she's gone? It's devastating for not only the patient, but for the family. So if you ask my family what it's done for me, it's given me a quality of life. If it doesn't change my disease, with gastroparesis, I could wake up tomorrow and my stomach could paralyze. I could be sitting here right now and all of a sudden the vagus nerve that causes gastroparesis could paralyze. I will die within minutes because your vagus nerve is your biggest nerve through your body. It sends signals to all of your other organs telling it what to do. Once your vagus nerve shuts down, my heart could stop beating. My liver will shut down. And once it stops, you can't restart it. So when you live with that kind of fear every day and you're that sick, it takes away your complete quality of life. I didn't even want to live anymore. I prayed so many times during my illness that let me just not wake up tomorrow, that I can't be this sick anymore. I was throwing up so much which you would think, well, how do you throw up if you're not eating and drinking anything? Well, nothing tells your stomach to stop producing stomach acid. And usually that goes through your body. When it can't, you're throwing up that bile all day long. I mean, epic proportions. Cachexia is what they call it, uncontrolled throwing up, which is one of my qualifiers for the medical cannabis program, including extensive amount of pain and nerve damage. I qualify under almost every section.
Right.
So it's huge. It's a huge change. It took some adapting because your doctors prepared you for how to die, because there was never an expectation of recovery. So now it had been an initial challenge for me and my doctor. It came with mental trauma, physical trauma. I'd been in bed 3 years. I forgot what living was. So now you wake up, you're taking cannabis, and you're like, wow, I feel so good. I don't even know what to do with myself. What am I supposed to be doing? Because I haven't done anything for so long. So I just started taking baby steps. But through recovery, there's some mental trauma too, because you're not taught how to relive. Your doctor can't say to you, well, if you recover, you're going to be able to do all this, or you can do this and you can do this. You're kind of on your own in your recovery with cannabis, because they don't know that much. We're learning. You learn as a patient yourself. And so it is a process, and it was a mental, physical, and emotional. I'm still recovering now. I lost literally 99% of my body mass. I had 0 fat, 0 muscle, and all of my tendons had shrunk. If you can imagine having, at 47 years old, to have to re-go through puberty, because that's essentially what I'm having to do. I have had to regrow muscle. I've had to re-stretch tendons. I'm having to regain weight, and then I'll gain weight. However, coolest thing, I've got an arm muscle. I don't know if you guys can see that. But last year, my skin was hanging off. Right. There was no muscle. There was no tendons. So it's still a very painful process that I have to go to. Right. My doctors expect it, if I'm able to continue doing the things I'm doing, walking around more, lifting things up, it will probably take close to another year for my body to fully recover from the damage of my illness. But I have a quality of life. I'm happy. I feel good. I can spend time with friends and family. I may never be 100% okay. I don't know if it's curing my disease. I pray to God that it is, that I don't end up down the line losing time. But right
Nicole,
now,
here's a question for you. I have to ask you this because our time constraints with Zoom are running out. But we wanted to hear your response to, when you find yourself needing to educate people about cannabis, what are among the first things you tell them on our way out? So could you share that with us?
Usually I start by telling people it's a kinder medication. It's something that doesn't leave you a mess. You can think on it. You don't get horrific side effects. There are some side effects to cannabis, though, and I educate those side effects. But if having the munchies, having a dry mouth or dry eyes is the side effect I get from cannabis, I would rather have that than to take a medication that sedates me into a form of a zombie. Yeah. That requires another medication to treat the side effects of a medication, to then stack on medication after medication to chase the side effects of every medication. Right. If I have something to say to everyone out there, and I always say this, never be afraid to talk to your doctors about it. Never be afraid to get a second opinion. If your doctor doesn't agree, educate yourselves. Research it yourself. Look at global research. Don't just look to the United States. Scientists are just as good as in any other country. Research it and understand it is a natural plant that has so many uses that are not even just medical. don't be afraid to try it. If you have something you are suffering from and you are using pharmaceutical medications, look into cannabis. Have an open mind. Don't stigma that people are just bad because they're wanting to use cannabis. We have to re-educate our society to accept that this is an herb, for one. It is a medicinal herb, no different than chamomile to make you sleep at night, to relax you down. Lavender that you might put in your bath water to soothe you, to help you sleep. Don't be afraid to try it. Don't be afraid to look into it. Sure. Always start low and slow, that if you're going to try cannabis, don't go gung-ho and give yourself a bad experience. Start low and slow, and don't be afraid that if one thing does not work for you, don't give up. Try a different format. Try a different strain. You have to be willing to experiment on yourself to try different formulations and different strains, because every single person's endocannabinoid system is different for them, and different strains, different products, different formulations are different for people.
Nicole McGarry. Oh, yeah,
have
please.
kindness. Have kindness towards each other out there. Help each other.
Kindness is huge, absolutely.
It is.
And with that, Nicole McGarry, I wish we had more time to share with you, but we'll be following up with you. And we are so delighted at your cannabis recovery and that you're willing to share more about your story with us with Salt-Baked Patient Profiles.
Thank you, and I love you all so much. Thanks for doing what you do. Peace out, everybody. Medicate good.
Thank you so much, Nicole.